In terms of adverse events occurring with standard supine-based AP high-velocity manipulations applied to the thoracic spine, the literature has shown occurrences where transverse processes have been fractured, ribs have been fractured, and in some of the most serious cases, an actual pneumothorax has occurred. So if you are using in supine an AP high-velocity manipulation, also in some circles known as a bilateral facet joint traction or distraction manipulation, which nicely distracts both facet joints, nicely stretches the facet joint capsules, and puts a shearing load through the disc joint in order to stretch that joint. It's a very effective manipulation, but if you feel as though your patient is struggling against you, if you perceive muscle guarding on the part of the patient, or if you just feel as you begin this A to P pressure, this dorsally related pressure, if you feel that the motion segment is too stiff, you should turn this technique into a cranially directed traction manipulation, which keeps all the structures that I just mentioned very safe. Okay, so we have Amanda in supine. We'll straighten this leg. We'll have her cross her arms across her chest to separate her chest from us. Okay? We then have her roll toward us. We use a standard pistol grip, which is used in most schools of manual therapy. We've identified the segment that's stiff, and we place that pistol grip on the bilateral transverse processes. I'm going to have Amanda flex her head here. If Amanda were to struggle against this, if I were to perceive muscle guarding with this A to P or dorsally related pressure, or if I just felt that there was not enough mobility, that it was too stiff in this direction, this is where problems can occur. So we change the angle of the manipulation. We get down a little lower, we press in a cranial direction, and then manipulate in a cranial direction. One more time. Take up slack in a cranial direction, and then manipulate in a cranial direction. That's not quite as strong of a stretch to the motion segment, but the point here is that keeps all of the tissues safe during this traction-based manipulation.